and this is Fracture Friday. For this episode, I have what's called a 4-part proximal humerus fracture. Okay, so what's that mean? Well, 4-part means that it's broken into 4 parts, and it's important because it involves, the proximal humerus involves the attachment for the rotator cuff, so it makes fixing the fracture and having a functioning shoulder afterwards challenging for an orthopedic surgeon. So this is the AP of the pre-op AP. So this is the fracture, and you just have to trust me, it's broken into 4 parts. So the proximal humerus, there's the shaft of the humerus where it comes up to what we call the metaphyseal portion, which is where it flares out. And then you have a head fragment, or what we call a greater tuberosity and a lesser tuberosity fragment. So those are all there. This patient also had a CT scan, so I can tell you I didn't get the CT scans to show you, but they're kind of hard to see without looking at 14 x-rays. So you just have to take my word for it. This is a 4-part. So the lateral shows the same thing, that it's very common to be broken into a bunch of little pieces up at the top of the humerus. So what we do, or what I chose to do for this fracture, is what's called a reverse total shoulder replacement arthroplasty. So this AP, post-op AP x-ray, shows that we remove the fracture fragments from the shoulder joint. We put the ball of the shoulder joint onto the scapula, onto the shoulder blade, and then we put the cup of the shoulder joint onto the humerus, where the shoulder joint is typically not that way, it's reversed. So this is a reverse total shoulder. In other words, we reversed the mechanical kind of dynamics of the shoulder. And the reason we do that is so that your shoulder becomes more deltoid dependent, because the rotator cuff is now deficient because the fracture broke all the attachments to the rotator cuff. The rotator cuff is no longer there. When we put this prosthesis in, there's no way to really efficiently sew the rotator cuff back to the prosthesis and have it stay. Tissue doesn't grow into metal so well. So we basically reverse the shoulder to make it more deltoid dependent, meaning the muscle on the outside of your shoulder can efficiently pick your arm up and you can use your arm like you used to. It's a relatively new technology, and it's very, very, very nice. I hope you enjoyed this video. Thanks for watching. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.